Now, India being the diabetic capital and the blood pressure capital also, that's what they are telling. So how you look into the gum part or the health of the gum for these two cases?
It's a very, very, very relevant question, Dr. Deepak. I would like to say here that maximum amount of diabetologists now have realized that periodontal disease or gum disease is one of the 6th complication, chronic complication of diabetes mellitus. So we need to pay a lot of attention here. On an average, I have at least 1 or 2 patients on a monthly basis where we tend to diagnose diabetes mellitus based on the gum condition. As in, the patient walks in with swollen gums, with pus exudation coming from the gums, bad breath, and then when we get the blood sugar levels checked, it's extremely high. And I have come across a patient as high as almost 585. Absolutely fine. No symptoms whatsoever from the diabetic point of view. The only symptom which was there was gum disease. That is situation 1. When it comes to diabetes, this is my personal opinion as a practicing dentist that anybody and everybody above the age of 40 should get their blood sugar level checked almost regularly. If you are in the peak of your health, then maybe once in 2 years. But if you feel that you have a relatively a laid back kind of a work where sitting hours are more and you don't have a very healthy lifestyle from the point of view of exercising, then compulsorily every year get your sugar checked. You might not have a history for that matter with your parents having diabetes mellitus or no, but still your environmental factors, you as an individual, what kind of food you're eating. Please understand, please don't compare yourselves to your parents or your grandparents. The kind of food that they used to eat, the kind of diet they used to have, as well as the kind of physical exercise which they used to have is almost nil as compared to our generation. So we need to be extremely careful in that matter. The second aspect is, I would like to call diabetes as of today, diabetes as well as hypertension as it's more like a lifestyle disease. Stress is an integral part of our lifestyle. Everywhere we have stress. Once upon a time, traveling from one part of Bangalore to another part of Bangalore was a piece of cake. It used to be a beautiful journey. But today, it's a stressful job. I mean, frankly speaking, if somebody has to travel about 10 kilometers in Bangalore, they will have to plan at least about 3 hours, 4 hours prior. This will always have a side effect on one individual's health, which is going to reciprocate in every organ of the body. Not just, let's not think about only the heart or the kidneys or the liver. Let us think every organ of the body. At the end of the day, oral cavity is also an integral part of the body and it's going to respond exactly the same way. So now the complication associated with the gums is here that antihypertensive drugs do sometimes cause swollen gums or enlargement of the gums. Now this, please understand, I would not like to blame the drugs per se, but a combination of bad oral hygiene as well as drugs are going to lead to massive gum enlargement. So we'll have to be very careful associated with the same.